Hi, this is David Gunn from the Queensland Eye Institute. This is a video about LASIK eye surgery. Queensland Eye Institute has two locations in Clayfield or South Brisbane where you can have your assessment performed. On the day you'll meet our friendly optometry team, who will test your eyes, check it to see if you're a candidate for LASIK, and you begin information about the surgery and a booking and consent form to read through before you come to see me. This is the laser eye surgery suite at the South Bank Day Hospital where your procedure will be performed. For LASIK, there are two parts to the procedure. The first is creation of a flap. You'll be lying under the FS200 laser to begin with, and here you'll see a tunnel of lights. The first thing you will see is a ring that will come quite close to your eye, and you'll feel slight pressure from it. Then the laser and tunnel will start to move down towards you. Your job is to try and look in this dark area in the middle of the tunnel of lights. As it comes down, there will be firm pressure, but there should be no pain. Your vision will go dark. Stay as still as you can and don't squeeze your eyes. Keep looking vaguely straight ahead. The laser will now form a flap, and it is important that you hold still. Try not to squeeze your eyes at all during this step. As the pressure comes off, your vision will return, but it will be very blurred. This is normal. The same procedure will now be performed on your other eye. After this time, you can relax, have your eyes open or closed, whatever's comfortable. We'll go on to the second part of the procedure, the excimer ablation. The bed will move over to the other side, and when you open your eyes, you'll see a whole bunch of different lights. Here there's a green blinking fixation light right in the middle. Your job is to keep looking at this light the entire time now. Some sterile drapes are placed over your eyelids, and a speculum is then placed. Initially this feels a little funny. After a few seconds, you adjust to it really nicely. The flap is marked, and you may feel some gentle touching, but there will be no pain. The flap is then lifted, so that the excimer ablation can be performed. Again, it's important to look straight at that green light now and look nowhere else. You hear a loud noise as the laser starts. You may even smell something like burning. Nothing is on fire. That's all part of how the laser works. The flap is then irrigated and replaced, and it will feel like water is running through your eyes. It's important to try and keep both eyes open. The interface is irrigated, and the flap just secures itself down without any stitches. Now some antibiotic and steroid eye drops are placed. The speculum and tape is removed from your lids, and that's the conclusion of the procedure. After this, you'll sit up. We'll move over to the slit lamp where I'll check you and place some shields over your eyes. Keep your eye shields on for the first night. Use your antibiotic and steroid eye drops. Avoid rubbing your eyes, and we'll see you the next morning to check how you're going. At this visit, most people's vision is pretty clear, and they're usually cleared to drive at that stage. Thanks for your attention. I'm looking forward to meeting you.